All right. Well, hello, everyone. I am Emily's co-founder, Lindsay Campbell. I am Chief Commercial Officer, and basically what I handle is a lot of customer service questions. I'm very involved with our wholesale side of the business with vets in the US. So I can very on a top level speak about the science, but I'm ultimately going to be probably the person you want to talk to get you marketing materials and sales materials or whatever you need to kind of tell the story to translate Emily's brain into layman's terms. So happy to meet you all. And if you have questions, reach out to Dave and he can forward any questions to us. So thank you.
And hi guys, I'm Emily. My background is my undergrad, University of Iowa, is microbiology and immunology. I focused in on pulmonary tuberculosis and primary and secondary infection. And I was the nerd in the BSL-3 when everybody else was out to the pubs drinking on a Friday night. I was in the BSL-3. Nerding out on microbiology. And then I followed my passion to UC Berkeley, where I studied general microbial development. And believe it or not, microbes go through developmental cycles. They build communities. They are social organisms. They are just like humans. Some of them are ornery. Some of them are nice, more often than not. Some of them are passive aggressive. Some of them are fucking bullies. And so I learned how microbes work for 6 years at UC Berkeley. And then I switched gears as a postdoc fellow in rheumatology and immunology at Stanford School of Medicine, where I learned the neuroimmune endocrine axis as it relates to autoimmune disease. But there was always this microbial component in TLR axis, activation and microbiome activation and antibiotic history and all this stuff, which triggers autoimmune disease. And then my grandmother, who was my best friend, had a stroke. And it turned out she had a tooth extracted the day before. And now we know in the United States that there's over 90,000 cases, Medicare and Medicaid, showing that there is a 50% increased risk of a heart attack or stroke if you get a tooth pulled. And we know that it shortens lifespan in humans if you pull a tooth. We definitely know in pets that if a pet has gum disease, it shortens lifespan up to a third of their lifespan. And so there's this very strong correlation between who's living in the mouth causing problems, and not just within the dental orifices, but also distally. So there's this oral systemic connection now that we're realizing, whether that's dementia related to gum disease, whether that's spontaneous abortions, premature birth, whether that's poor failure to thrive, it's pancreatic cancer, it's UTIs, it's pancreatitis, it's liver issues. One of the biggest ones is actually CKD, chronic kidney disease, in humans and cats. And that's because these common organisms that are anaerobes that live and fester below the gum line that drive the disease process they spread. Whether you're a cat or a human. And so we're focused foundationally on trying to solve for these root cause problems that lead to tooth loss, that lead to systemic problems. And so that's what the origin story is for the foundational technology that gives rise to TEEF. So my grandmother had her issue. We figured it out, and then I rescued a Cocker Spaniel. She was 10 years old. She was fundamentally neglected, bred her whole life, caged. She was really abused, and they said that she needed dental cleaning. She needed not just a dental cleaning. It turned out that when I rescued her from the Humane Society, you could smell her before you saw her. She smelled like death. And she had to have, within 2 days after I rescued her, she had to have 21 teeth extracted. I had to spend about $6,000 on my credit card to save her life. And she had to have gobs of antibiotics pumped through her body to save her. And so that's when we first started to work on pets. And then that's 10 years ago. And since then, we've been working on dogs, cats, horses, gorillas, orangutans, ferrets, snow leopards, seals, sea lions. Lindsay, what am I forgetting? What? You're muted.
I was gonna say like cows, like
Cows. Yeah, cows.
Yeah.
Okay. Yeah, good call. 80% of cows in the U.S. get cavities too, and that fouls their milk and sperm production. But that's an aside. That's production animal speak. Liver issues too. So what we're finding is that the microbes don't stay in the mouth. If you have a mouth and you're warm-blooded, these microbes are going to spread because they feed off of our heme, which is our red blood cells. And so they constantly cause wounding in our mouth to gain access to the bloodstream so that they can spread and grow. And then they cause inflammation wherever they go. So we're focused on the mouth because that's the origin story and the root cause of a lot of systemic problems, not just dental problems. And, you know, about a third of the lifespan can be lost in a cat or a dog if they have gum disease, stomatitis, resorptive lesions, stuff like that. So we're really focused on trying to improve quality of life and longevity in our furry loved ones. And so that's why we exist. We're not carpet bombing the mouth. We're focused on growing the good by feeding them better. So what we found in our surveys when I first adopted Tinsley was that a lot of the products on the market, dental chews, dental toothpaste, dental additives, dental whatever, literally kill. They kill microbes. And I come from a background where if you're strong enough to kill a microbe, you're going to really, really affect that host animal too, because the host cells are more fragile than the microbes. The microbes can, we know microbes can withstand nitric, like lasers or gamma radiation or bleach for 70 minutes in a preformed biofilm, or the craziest new antibiotic, they become resistant to it within a month. And that's why no one's investing in novel antibiotics anymore, because it's futile, which is really sad, and that puts us all at harm. But the thing is that these microbes are really, really good at surviving. And so our approach is not to tax them and force them into a survival mode. Instead, it's to feed them differently so they behave differently. Because we know that a lot of carbohydrates and unnecessary fillers are in dog foods, cat foods, dental treats, dental chews, all sorts of things that dogs and cats should not be consuming on a regular basis. And that's growing the wrong kinds of microbes that are causing the real big inflammation below the gum line that leads to tooth loss. And so we're focused on steering the microbes away from that diet that the dogs and cats are being fed. And so we're literally putting the microbes on a keto diet. And I'm very happy to share slides, but I really want you guys to ask questions. Like, we've gone through year-long studies in dogs. We've done zoo animals. We've done humans. We've done crazy dementia patients, like crazy studies, and orthodontics, special needs, folks that don't get their teeth brushed on a regular basis, like dogs and cats. And we're showing that we can tune the microbiome away from a harmful ecosystem into a beneficial ecosystem. And that has downstream clinical benefits, stopping bleeding gums, reducing plaque and tartar, really improving the oral microbiota through salivary testing. And then the downstream benefits are even more spectacular, more impressive, and we're still wrapping our heads around the connection between these oral microbes and downstream systemic microbes. So I'm very happy to open it up to questions ahead of time, or I can just dive right into a slide deck, whatever you guys want. But I want this to be more interchangeable and dialogue-based Q&A. Dave, you're muted.
I'm just going to say if anyone does have them, jump in now. Otherwise, I'll get you to do your thing with your slideshow.
My intro.
We did have a question.
Yes, please.
We find that some people are a little bit tricky about wanting it in the water, but it's been suggested to us that it could be put on top of food. Is that the case?
Yeah, it can be put on top of food. It is most effective if you put it in water because it's water soluble. And when it's water soluble, it goes right into solution, and then it can get in the soluble phase so that microbes even below the gum line can start to pull it in through their mechanisms of feeding. And what's really cool is if you have really big plaque and tartar buildup subgingival, so let me just show you examples of what I'm talking about, that because I find that's the most effective. So like in a patient that's like this, right? Can you see that?
Yeah.
So tartar and plaque build up below the gum line. They grow up the shaft of the tooth. They don't start at the tip and go down. They start below the gum line where it's protected and the microbiome grows up. And so this is really upset tissue. It's orange, almost white, which is neutrophil activity. White means pus. And so this is really upset tissue. And the biofilm below that is not producing oxygenating byproducts. So the tissue is starved from oxygen, which is why it's white also. There's immune and metabolite mediated. So tissue, looking at tissue is a really important thing. And that's one of the things that I'm trying to teach human dentists and veterinarians about is mucosal immunity and why you need to pay attention to mucosa and what it looks like. So this is baseline in this dog, March 9th, 2022. April 13th, 2022. This is what it looked like 30 days later after just drinking it in the water. Because when you feed microbes a better diet, even though the dog's not eating a different diet, you're able to literally, the microbes feed below the gum line, and they're secreting things that are nitric oxide based, alkaline, and that quiets down the immune system. And then you're not allowing them to eat carbohydrates in the diet, which is blocking their ability to make things like massive plaque and tartar buildup. So you're basically blocking them from doing that. And then it just kind of goes away based on the dog's diet, or you can just wipe it off with your finger after 30, 60, or 90 days. Depends on the disease state of the dog, the amount of times they drink the TEEF water. It does depend on multiple variables. And then also smaller dogs don't produce as much saliva. They also have less liver producing antimicrobial agents per cubic centimeter of saliva production compared to a bigger dog. There are a lot of variables that go into this. They also have a ton more microbes compared to like a Great Dane equivalent. So they've got an uphill battle to begin with. And so they need to drink a lot more water or get it in their on top of their food. And it's got to be multiple doses a day. And this is where we found that a single dose doesn't help. It's really frequently throughout the day. It can be small amounts throughout the day, which is actually the most beneficial. But they have to get it at least 2 to 3, preferably 4 to 5 times a day. So if that's drinking the water and putting it on a topper on their food, or brushing their teeth with the powder, whatever it is, get it in their mouth.
Oh, cool.
Okay. That was one of my questions. So you're not advocating it as a mixed regime in terms of toothbrushing and teeth, and you're basically saying because of the way it's changing the microbe colony, you're better to use it in an abrasive way with teeth brushing with it, as opposed to using a separate like dental product.
Yeah, you can use it passively, and that is just as important, which is contradictory to everything we're ever taught in dental, because the microbes clean between the teeth. You don't need to floss. They eat constantly. And so if you have foodstuffs between the teeth, if you have foodstuffs on the teeth, they will constantly clean the teeth because they need to eat, and they eat from midnight to they eat 24 hours a day, 7 days a week. And they secrete things that are beneficial or harmful. And so what we're trying to do is curb what they eat and change what they secrete. And so in order to do that, you have to hit them a couple times a day is what we're finding. And the most beneficial way is to put it in their drinking water or brush their teeth with it. If they don't, the best thing is put it in bone broth or goat's milk, cut it with water, or put it on top as a topper on their food, as the quote unquote least beneficial way, but it's still going to help.
Cool. And you're not ever going to like overdose a small dog or something like that if they're drinking it and you brush their teeth with it? And
yeah, you're asking the right question. So what we find is the older the dog, the smaller the dog, or they are a certain breed, which are the short-nosed, or the super hyperactive small dogs that are super smart that get into trouble a lot. Yeah, so those dogs, they have a very different neuronal system. So what we're finding is that we humans, mammals, dogs, cats, sea lions, seals, we're owned by the microbes that inhabit our GI tract from the mouth to the anus. And they dictate when we're hungry. They dictate when we're satiated. They dictate when we're upset or ADHD or anxiety ridden. And you can actually curb it by changing the microbiome. In order to best do that, we're finding it's not through a drug or an antibiotic. It's actually through what you feed them. And so that's why we're going through a feeding approach. But you do see side effects. For older dogs that are the most dysbiotic or diseased, you will see more aggressive side effects. I will call them side effects, but they're really microbial responses to the fact that you're putting those microbes on a keto diet. So Candida, E. coli, Shigella, Salmonella, Porphyromonas, Streps, Staph. They don't like being equationed out of an equation. And so they don't go silently in the night. They may cause transient loose stool. You may see dogs that like brush themselves if they have short nose, like French bulldogs and stuff like that. They definitely have more sinus issues. You will see a clearing of the lacrimal gland exudate. You may see a slight increased discharge in the ears because it's all a shed, because the microbes spread through the soft tissue palate and in the mouth and go up and out and into the brain. So in humans, we're seeing a betterment of cognitive a regain of function in cognitively declined patients that have high porphyromonas species in their mouth, Alzheimer's patients, early stage. You're going to see that in certain dogs that are Alzheimer's or dementia risk profiles, because we're reducing the microbes that are really strongly linked to really upsetting the neuronal system. And then downstream, you might see slight loose stool for a day or two as we change out the downstream gut. And that's because we swallow anywhere from 500 million to 3 billion microbes a day, depending on the dog and their salivary. Cat is a totally different ballgame. No one really knows how many microbes cats swallow a day. So I'm not going to speak on that. And then as far as urinary tract, general urinary tract, we definitely know there's a shedding occurrence in cats and dogs and humans when you put all of us on the protectin water additive. And that's because we're getting rid of, again, these sugar-loving microbes, and they can't hold on, and they get beaten out by the beneficial commensal microbes that can hang on in a diverse diet.
Okay, cool. So you might see effects, but really it's nothing but good.
It's a really good thing long term. But the key is to have your clients hang in there, man. They need to hang in there because they're going to be like, oh my gosh, my dog is like blah 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 blah, and you just have to have them hang in there because they need to shed those bad microbes.
Cool. Thank you.
Yep.
I don't have anything else.
Do you want to just continue on then, Emily, then?
Oh yeah, you betcha. Sorry, my Midwest accent's coming out.
You betcha. From Minnesota.
Oh yeah, I know. Okay. Yeah. So some of you guys may know our mechanism, but some of you guys may not. So we're really focused because we realize that the propensity of the problem in feed is freaking carbohydrate fillers that are super cheap, and they're being stuffed into feed, whether you're a dog, a cat, a goat, a sheep, or a cow, or a horse. You're being fed a bunch of simplified processed carbohydrates. That grows really bad inflammation causing microbes. And so our whole focus is stopping that microbiome from the mouth to the gut from seeing those ingredients in feed. And the cool thing is we've shown, and now in this 595 patient human study, which validates all of the dog, cat, rat, rabbit, gorilla, other non-human primate studies showing that, yeah, these ingredients that we're providing are solely focused on the microbes, not absorbed by the mammalian gut. And we feel strongly that it's a way better alternative to sugar alcohols. So we're literally applying a twofold approach in molecular ingredients. So we're literally cooking up the recipe we want the oral microbes to eat, even though the cat or the dog are not eating those feeds, if that makes sense.
Emily, I just got to ask, can you expand your screen so it fills a bit more in? That'll be great. Thanks.
Yep. So we're literally taking two prebiotics and that are geared towards microbial language, and we're telling the microbes in the mouth to start to look for proteins. And then we're using a postbiotic, which is made by soil microbes, to trick other microbes and basically stop them from eating sugars and carbohydrates. And so we're using this dual approach to put the oral microbiome on a keto diet. We're blocking sugar eating, and we're telling them, go eat steaks in the mouth. Go eat salivary proteins and salivary amino acids, which outnumber sugars any day in a dog or a cat or even a human. And so what that does is actually causes a reduction in acid production, which is great because acids cause inflammation. Acids cause leaky gums, leaky gut. And then instead, we're inducing the production of nitric oxide and alkaline agents that are anti-inflammatory, and which oxygenates below the gum line, which is really important to chase out these microbes that are really strongly driving gum disease. You don't need any of our products if dogs and cats don't eat carbohydrates. But the problem is that how many dental treats on the market have rice or wheat or sweet potato or pea protein, whatever, with drag along carbohydrate, which feeds these guys that really drive the disease process and tooth loss. And so what we're doing is just not providing an atomic bomb in the mouth by blowing up everybody with an antiseptic or an antibiotic. We're really just tailoring the diet of the microbes to stopping inflammatory processes from happening and tooth loss from happening. You don't have to have us if people know normal hygiene, but they don't. We all kiss our dog. I kiss my dog all the time, but he's on TEEF, so I'm like, I feel extra confident. But you don't want to share utensils. If someone in the family has gum disease pathogens, we know through our salivary testing results that those microbes spread across species. Doesn't matter if you're human, dog, cat, ferret, or rabbit. They're very promiscuous microbes, and they cause the inflammation and the resultant tooth loss. And so you really need to teach diligence and vigilance with how we handle our toothbrushes, how we kiss our family members, how we decontaminate our toothbrushes, and things like that. And so that's what needs to also be taught, which in addition to diet, it's habit. And then also we need to teach that it's not just about plaque or tartar. University of Birmingham, King's College of London, they've all shown that you can have the biggest tartar buildup or plaque buildup, and doesn't mean you're going to have cavities or gum disease. You can also have the cleanest teeth in the world. You can have rampant gingivitis and gum disease. It's about who's living in the mouth and what they're doing. So we really need to teach people signs of bleeding gums, pissed off gums, inflamed gums, orange color, red color, that lining between the gingiva and the tooth interface. We need to start teaching that stuff instead of tartar and plaque buildup, because tartar and plaque buildup does not actually have clinical outcomes. And so that's where we've been trying to educate folks. And we're continuing, we have this concentrate we've provided in water for water additives, which is the best way microbes take this up. It's the most efficient and effective. The problem is that cats and small dogs don't drink a lot of water, or raw fed dogs don't drink a lot of water. And so that's why we've come up with our freeze-dried approach, which has yet to launch in New Zealand. And we're talking about what substitute proteins we can use, because again, we want to keep these microbes on that keto diet, eating animal proteins, which is for the benefit of not just the oral microbiome, but the gut microbiome and the animal itself, because dogs and cats really need to eat a lot of animal protein. And so our approach literally is, again, to block carbohydrate feeding microbes that make acid, plaque, demineralize enamel, piss off the immune system, and then hyperactivate microbes that reduce nitrate to nitrite and produce nitric oxide, alkalinize their environment, and chase out the bad. And so we've got karyogenic bacteria. I know a lot of you guys prescribe probiotics. What I can tell you is if a dog has gum disease, there's no way in hell a probiotic out of a capsule or a lozenge is going to grow. because they're getting inundated with danger signals constantly. Because one of the strong points and strategic armaments that gum disease pathogens have are antimicrobial agents that they secrete. And so they're sending out signals to stop good guys from growing. So no matter what probiotics are being administered in the feed, in the water, in capsules, there's no way they're going to grow because they're receiving dead signal or death signals. And what we know is that if you pre-treat with TEEF, we stop that bad behavior. It's like we're basically busting the party in the college, right? For all these, I don't know, sorority people are wanting to like do an uprise, and we're basically squashing that uprise, and we're telling them to behave. They can have fun, but they can't be unruly. And then that is allowing, therefore, them to send out signals that are beneficial signals that are sending to these probiotic strains that allow them to grow. And so so if you do probiotics, definitely pre-treat with TEEF or something similar to TEEF to make sure you squash down those unruly behavior microbes and allow those probiotics to actually do what they're meant to do. In studies we've done with salivary testing companies like Animal Biome, they did this and gave us these data, thankfully, showing we can significantly reduce harmful gum disease associated microbes in multiple dogs in as little as 5 days, which is great. And having just so you know, because I come from the human side too, in 5 days in humans, if you can get a reduction from 4.2 or 42% of the whole oral burden of Porphyromonas to less than 10% in 5 days, that's pretty spectacular. You can't get that in human. You can get maybe a third of that in human. But this is where adding it to the drinking water really does help with compliance and help with faster results if dogs drink water more frequently. And then you can see that happen, which I showed you guys earlier. So if dogs are really vigilant about drinking the TEEF water, you can see a complete shift in 30 days, as little as 30 days. If they don't drink as much water, it can take about 90 to 120 days. You just have to maintain that. And that's why we came up with the topper, was to reinforce those microbes to continue, because they have to battle against the dental treats, the chews, the kibble, all that stuff that's carbohydrate ridden that drives gum disease and tooth loss. And so it makes our technology have to work really, really hard. So we've had to come up with novel ways to get it in dogs and cats' mouths more frequently. And the cool thing, unlike a lot of toothpaste or water additives that are antimicrobial, this does not induce antimicrobial response. So we're seeing a continued over a year time course study during COVID. We did over 300 dogs, and we showed a continual reduction in gum disease associated pathogens over time. And we showed a concomitant increase in beneficial microbes in their mouths. And you can see that in just some pictures. This dog on the left was from Singapore. I don't know, Linz, was this Sheltie breed?
It was a Westie.
Westie breed. But you can see abscess of the upper canine, really nasty plaque. 14 days, no vet intervention, just drinking in their water, calmed down the inflammation because we changed the microbial diet. Now, does this dog need vet intervention? Heck yes. But at least we took it down a notch. And in this case, on the right-hand side, this is a holistic dentist patient whose pet parent really felt strongly that the pet needed to get acetic acid all the time in the form of vinegar, apple cider vinegar, because that was antimicrobial. and you can see, whoops, it really upset the tissue. We had to talk her down from using it and grow back the beneficial microbes. And you can see after 60 days, there's a regain of just benefit. Like this dog still had a little bit of perio in the latter, oh my gosh, I'm blanking because it's like 8:37 my time. Not molars, premolars. But we calmed down the tissue, changed the pH in the mouth, and changed the microbiome. What we've also shown, this is important for cats, and we've done this now in snow leopards with resorption problems. We've done this. We've been told, we were first informed that TEEF had an effect, a benefit in stomatitis in felines in Australia, actually, right before COVID. We were unable to investigate that further because of COVID shutdown stuff. But now we've done a lot of studies in felines with either stomatitis, resorptive lesions, or gingivitis, or advanced perio. And what we know is we take a scraping of their subgingiva, we grow it up. Here's their baseline ROS, reactive oxygen species, so it's really suppressed. But if we treated that same biofilm with protectin for cats, you can see a gain of function. So basically, we're enabling that subgingival biofilm to then start to go through that keto diet and make reactive oxygen species, aka nitric oxide. And what happens on the right-hand side is actual felines, when we treat them, you see a significant reduction in a very short time frame of 48 hours. They're not able to grow. These anaerobes below the gum line are really inhibited from growing because of the reactive oxygen species that the beneficial microbes are now enabled to produce. And we've done this over and over again, not just in cats or dogs, orangutans or gorillas or snow leopards or sea lions or seals. We've done this in dementia patients. We've done this in orthodontic adolescents. And we're showing the same thing. Cutting off sugar stops candida. It blocks enteric bacteria from growing in the mouth, MRSA, strep mutans, which most animals don't get, massive cavities, except for bovine. But we're able to grow beneficial microbes that can cause problems if they're fed the wrong way. And we're feeding them in the right way, and they're flourishing. We've done numerous clinical studies with salivary testing in humans with gingivitis, and we're showing a significant reduction in complex called RED, which is really high risk for tooth loss and periodontal disease. And we tested ourselves against placebo, which was sugar alcohols. On the human side, you can feed humans with sugar alcohols. You can't necessarily do that on the pet side. But yeah, there's an equivalent of tooth change of plaque, but below the gum line, that's where you see the magic. And so our technology is really brought below the gum line to change what microbes do. And we show that here in figure C, where patients were enrolled because they have bleeding gums at baseline, and then at 6 weeks, they didn't have any more bleeding gums compared to control. And so that's just gonna, I'm happy to stop here and take questions. I don't want to go and suck up all the oxygen, but I'm very happy to answer any questions you guys have.
I'll jump in and be the one. We talked yesterday a little bit about pancreatitis.
Yes.
And so I think it's important, because we do have this conversation in our training sessions, to maybe just elaborate from your perspective, like I sort of said yesterday, is to have the same, I guess, clinical or sorry, have the diet set by the clinic, and then I guess suppressing those the pathogens, the Phorophomonas, from that. And so just explain from your perspective on that one would be great.
Yeah. So Porphyromonas in particular is very, very dangerous. It's the only organism, I think, aside from treponemas, that keep me up at night as a microbiologist and immunologist. It is very scary because you can have, it can reside in your mouth and not cause problems. It can also reside in your mouth and not grow, but secrete things called extracellular vesicles that can translocate across your blood-brain barrier, go into the brain, linked to dementia, go into the kidney, linked to chronic kidney disease, go to the pancreas, linked to pancreatic cancer, because it's very pro-inflammatory. And we show that in 6 weeks in patients that test positive for Porphyromonas, this is human, we can eradicate it by 90% in 6 weeks. In dogs, we show we can eradicate it by about 4x in 5 days. In a year-long study, we can eradicate it by about 90% as well in if they drink it in the water.
So, oh, sorry. Can I just add a question into that?
Yeah.
So because we know that it's prevalent in the mouth and we have dogs like mini schnauzers and that predisposed to pancreatitis, is it really advantageous? And I know the idea is to get as many dogs on TEEF as possible anyway, but exactly to have these guys, talk to their mini schnauzer owners, et cetera, that this is a really viable option to, to reduce the likelihood.
It is. But the thing about schnauzers are interesting is they seem to be controlled more by their microbiome than most dogs. So they will probably have more nocturnal urination we've seen in the US. I'd be interested. Please give me some feedback. If you see nocturnal urination complaints of schnauzers, mini schnauzers in particular, in New Zealand, that'd be really interesting, because then that means it's a breed-specific microbiome-driven phenomena. So microbes have circadian rhythm just like mammalian cells, and certain things go off and on during the nocturnal cycle. And so I would love to learn more about you mentioned schnauzers in particular, so that's why I'm nerding out on this. But it's the only breed we've seen with nocturnal urination phenomena as they're shedding.
Right. Okay. Because I can see some people are having to go, but while we're sort of talking, just with the ones that are here, we are recording it, so if you do think it's of benefit to others that haven't been able to join in onto the meetings, you can all contact me, dave@kvet.co.nz, and we can try and get that and pass on. Was there any other questions? Because I don't want to be all the question taker.
Can I just ask, because cats are problematic because they tend to drink in so many different locations, would you be better, given that TEEF is better from a solubility point of view to be in water, mixing a small amount with water and then adding that to food? Would that be a compromise?
That'd be a great compromise. The other compromise could be goat's milk or bone broth, or some kind of protein-based broth that they would drink that you could add the TEEF directly into, so it's solubilized.
Like a 50-50 mix.
Absolutely, 50-50 or 70-30 or whatever. The more TEEF, the better for cats.
You're trying to do multiple times a day, ideally.
Yeah, that's the thing. You can hit them if you can only hit them once a day. The most important time to hit a human, a dog, a cat, a goat, whatever, a ferret, is right before they go down in sleep, because the microbes don't they're not silent. They're not sleeping. They are actively eating and secreting. So if you can block them from making all these pro-inflammatory acids and things like that, we're finding that is, if you can only hit them once a day, that's when you hit them.
And so when you're talking about maybe putting it in smaller amounts of liquid or broth, are you doing the full scoop multiple times a day, or are you trying to split that one scoop up into a daily amount?
No, honestly, it's not cost effective. Yeah, this single dose is the dose for oral microbe population, whether you're a Great Dane or you're a Chihuahua. Because Chihuahuas and smaller dogs actually have more microbes in the mouth than Great Danes and Mastiffs and bigger dogs. We've done those studies. So it's more about frequency than total dose.
Well, something that we recommend over here is just to kind of like make a pitcher of water, put a couple scoops in there, store it in the fridge for up to like 4 to 5 days, top off your water dishes with it. Because yeah, I mean, money's tight for everybody. And I think that that's the best way to just literally be able to at least assure that they get something. As long as there's something in the water, it will help.
We do train that. We do ours is every 3 days is what we've talked about. 1 scoop into every 3 days.
Great.
And maybe, and actually this is a good question actually, because of late what we've been doing is maybe with, for instance, if you remember, we did talk about yesterday, the dog that has a lot of dental disease that I sent that pictures through that we're trying at the moment. Probably like one of the worst gingivitis cases is trying to give them enough to put 1 scoop in their daily drinking water to really try and get on top of it, and then look as the dog gets better, potentially down whatever that 3 month or more is, to move to more, I guess what you would call them, could potentially call a maintenance style dose. Is that accurate?
Absolutely. So the cool thing about the powder is it's flexible. It's concentrate. So you can either blow that entire concentrate dose by brushing their teeth, which my dog will never let me brush his teeth, even though I keep on trying that every few months, and he runs away now whenever he sees a toothbrush. Or the passive way is to put it in their water or on their food. What we know is even a lick pad, however you get it in their mouth, that's the best, especially if you can get it through their tongue, because the tongue is the sponge of the mouth. You can even, cats actually really like to lick the powder out of your hand or on some surface. And they have those apertures off their tongue, right, which are curved, and they collect saliva, and I can nerd out on that all day long. But basically, that's the hit, the big hit, if you can get it on their tongue, because then it will dissolve slowly over time and migrate to the rest of their tissues in the mouth. Dogs, they salivate all the time. If they're big dogs, small dogs, tricky. And it's all about how to get it in their mouth frequently throughout the day.
I've got one more thing actually, because and it's just sort of backing up what I train as well. But we get a conversation quite a bit about multi-households. And I know when you were going through bringing out the cat one and sequencing, genome sequencing them, etc., that it was found to be beneficial to use the dog, specific product. And then obviously with the introduction of the cell wall of cracked chlorella specific for the cats. So is it fair to say as well that multi-households obviously can continue on with the dog, but if maybe there is a circumstance where the cat has stomatitis or something along those lines, then that might be more beneficial just to, as that toxic sponge of the algae?
Yeah, so actually dogs too, or any other animal. So if you suspect aspergillus or candidiasis, colonization in the GI tract, actually it doesn't matter what species the animal is, put them on the P30, Protectin 30, because the chlorella we found is really a really good antioxidant, and it's a molecular sponge. So it sucks up all these neurotoxins that the fungal species secrete, and also the insidious immune modulators and neuromodulators that the fungus secretes. And we found that the cat, because they don't salivate enough, they don't drink enough water, all of these things, they are the breadbasket, so to speak, of fungal infestation. And so that's why they're more prone to, we hypothesize, which we have pretty strong data now. That's why they're so subject to resorptive lesions and stomatitis, is because these fungal pathogens are secreting these growth factors that are teaching and training the fibroblast to outgrow and cause these absorptive lesions and pain, and stimulate the pain fibers in these animals. And so that's why we recommend Protectin 30 for anybody, that even humans, even cancer patients on the human side of our business that are having lesions like that.
Awesome.
I think it's worth noting though too. So just in my customer service experience side, that observe if you give Protectin 30 to the entire household, if the dog is avoiding it because of chlorella, then you definitely should go with like a P42.
Yeah,
Just
and
to
that's exactly.
make sure they're getting something in there, which will still be beneficial. But some dogs can smell the chlorella.
So they don't
So I
like
think it's,
It kind of has this fishy smell.
yeah, it's a little fishy. I mean, most dogs love it by all means. However, I think it's worth noting to your pet parents to say, just observe. If your dog isn't drinking that, then get either both formulations, or just do the one.
And what we have learned is that wetlands, about 10 to 15% of pets sense a change in their water. Yeah. And so so if you ease them into the change, they're very happy to walk into that. But if you just hit them right away with a full dose, they'll back away. But after 3 days, they'll walk into it, and they'll be fine with it. It's just they change.
It's definitely something that I certainly talk about. Is we talk about fussy dogs as well, or we just talk about easing them in if you have any concerns along that line. So, were there any more questions? Anyone else have anything else to say? Because getting later and later, I see it's darker and darker in the background there over in the States.
Oh, it's fine. We're happy to stay awake.
Yeah. Anything else, guys? Awesome. All right. Well, if that's the case, thank you so much. I actually learned more again today. So that's super fascinating and appreciative of both your time today and spending the night with us, obviously our afternoon. As I said to all the other guys, if you get in touch with me, if you have any questions or you want the recording, Lindsay will get that out to me, hopefully, or Emily in the near future. But I appreciate you joining us today, and hopefully we can do something else like this down the line.
Thank you so much.
No worries. No worries.
Have
awesome, guys. Yep.
Have a
Thanks
good
very much.
day. Bye.
Appreciate your time. Thank you guys so much.
Bye for now.